DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. We're going to have a great show. Dr. Jacob Hagenmaier is here with us. We're going to talk about feedlot data, data interpretation, things that you may not think about on a day-to-day basis that Jacob and I work with all the time. So stay tuned.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodyrus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson, and I'm here with my friend and colleague, Dr. Jacob Hagenmaier. Dr. Hagenmaier, Dr. Jacob as we call him, is a veterinarian. He also has his PhD in diagnostic medicine and pathobiology. He does a ton of research. He's the CEO of Prairie Rock Research here in Manhattan, Kansas. He also is a feedlot consultant with us at Production Animal Consultation, and good to have you.
Pleasure to be here as always.
That's great. That's great. We're going to talk about feedlot, just data, informatics, and that. But I guess to just kind of kickstart it, how do we gather most of our feed yard data out in feed yards today?
Yeah, so good question, right? Basic question, but our yards are equipped with electronic data capture systems, and there's a few different kind of legacy ones for bigger clients. Then there's even some newer kind of smaller data platforms for farmer feeders, smaller scale guys, to be able to, basically instantaneously capture feed, health data, inventories, et cetera, all along the lines, but really some comprehensive, easy to use systems that our feed yard clientele have at their disposal, to track their information.
Yeah, and so, when we look at that, there's important reasons to do that, from feed, delivery to financials to all kinds of things, right?
Yeah, absolutely. Well, from a veterinary perspective, you allude to a couple of them, but first and foremost to me comes, legalities, right? As veterinarians, we prescribe antibiotics for our clients to use, and so making sure we're using those in compliance and observing applicable withdrawal periods to ensure that our food, our cattle that are being harvested are clear of or have satisfied those withdrawal periods. But to your point, financing, accounting, feed calls, feed deliveries, being able to see what the cattle are eating, how well we're mixing our diets. So we all know we have our target compositions, but how well are we actually batching? Because we all know it's a margin business, right? And devil's in details. So how well are we mixing? How close are our calls to our targets from both feed batching, feed delivery records, all the way down to individual animal morbidity, mortality diagnoses, et cetera. There's a lot of information we can capture in these various systems.
Yeah, we're never short on data in feed yards. The ability to track treatments and subsequent withdrawal or clear to ship is vital to everybody's operation. And if you don't have the fanciest computer, that's probably the most basic data recording that someone should do, even with a notebook paper.
Absolutely. Yeah, it's critical to ensure that we're maintaining the safe, wholesome food supply that we've,
What exactly does a withdrawal time mean?
So we can really get into it, but at its basic components, the amount of time based on FDA registration studies to where drug residues and metabolites are below the required threshold for that food to safely enter the food supply for human consumption.
So an example would be when we treat with a drug and it has a 28-day withdrawal, we write down the date that we treated them, and that animal can't be shipped until
28 days later.
Subsequently.
Correct.
Yeah. And, you're involved in the pre-approval and post-approval type work. So a lot goes into that number.
Yeah, it's not just an arbitrary thing. There's a lot of science and a lot of math that goes behind it that we don't have time for today, but they're very important to be compliant with. And again, just one component, one small piece of our broader data portfolio that we've got to be able to manage in our complex cattle feeding systems.
It's great. Folks, we're going to take a break. When we come back, we'll talk more with Dr. Jacob here about feedlot data, data systems, and much more. Hey folks, Dr. Dan here. Welcome to Cattle Intel by Neogen. What we're going to talk about today is gate safety. And we talk a lot about cattle handling. We talk a lot about animal welfare. We're going to talk about human safety on your operation. And probably the place that we see the most accidents occur are gates. And we need to make sure that gates aren't sprung. We need to make sure that gates flow easily and shut easily. And another one is we need to make sure that the latches that we have on the gates work properly. If you have quick latches, make sure that they latch, because when we see people get hurt is when cattle come against the gate we think is latched and it comes against us. Make sure you stay tight to the gate when you're shutting gates with cattle, and never load too many cattle into a pen or onto a scale, causing them to come back on you. This has been your Cattle Intel from Neogen. I'm Dr. Dan.
Are you a cattle feeder looking to manage for a stronger and more profitable set of cattle? Look no further than Igenity Feeder. Igenity Feeder utilizes DNA to gain insight into your cattle's genomic potential, with the information to predict performance, quality, and economic endpoints for cattle feeders. Animals are scored and ranked in a simple format, driving more precise and accurate management decisions. Igenity Feeder gives you the power to predict days on feed, manage variability within lots, characterize carcass performance, and focus on metrics important to you and your operation. With the data provided, you will identify superior animals earlier and maintain high operational efficiency. Maximize your profit and optimize performance with Igenity Feeder.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Jacob Hagenmaier. He's a DVM PhD. He's the CEO of Prairie Rock Research and a veterinarian with Production Animal Consultation. I get to work with him every day, and it's awesome to work in feed yards and cow-calf and stocker and retail and packer operations. We really get to cover the gamut. We're talking about feed yard data. And so I said, let's do one on like defining the population of a feedlot. And so as cattle are received, what are some things that we're recording?
Yeah, I mean, I think you're kind of alluding to it, but all 10,000 head feed yards or 30,000 head are not created equal, right?
Yep.
And one of the predominant diseases that we deal with in feed yard medicine is bovine respiratory disease, or BRD. And so one of the most important things that we can do, and one of our key data collection points when we know a group of cattle is coming to us, obviously there's the very straightforward things like how many, average weight, origin state, et cetera, owner. Those are pretty straightforward. But one that we talk a lot with our clients about is risk categorization. So when we say risk, we're talking about what is the likelihood or probability that this pen or group of cattle will succumb or develop BRD, morbidity, and mortality. And it's important because depending on how we classify those cattle as low or high, some have an intermediate, medium risk, that can be a lever for some intervention strategies, different management strategies on how we manage a pen or a group of cattle relative to the broader population. And it's important to make sure we know just how many of each risk classification we have, and that we're not overwhelming the system with our caregivers, and that we're setting both cattle and people up to be successful.
So if I said high risk versus low risk, what would be some things that would differentiate high risk versus low risk?
Yeah. Weight obviously is a big one we look at. It's one of the least subjective and most objective data points we have. And right or wrong, a lot of times we'll use body weight as a proxy for age. And so the older a calf is, the more competent his immune system is, or hers, and likely that they'll be able to resist BRD. So lightweight calf, potentially young calf, long haul transport, commingling, sale barn origins, other potential known predisposers. If a truck broke down and they were off water longer than we wanted them to, things like that are all pieces that come to this equation basically to come to this risk classification. So then again, we can deploy our management strategies and give those cattle the best chance to be as productive and healthy as we can.
Yeah. And so, if we get 8-weight yearlings local off of rye pasture, probably going to be low risk.
Yeah.
Okay.
Yep.
And so then, how does, we also, when I define the population, I look at days on feed. How does days on feed, we have high risk and low risk cattle in the feed yard, and then days on feed. Tell me why days on feed would be important.
Yeah, so specifically with BRD, and our different causes of morbidity, mortality can occur at different segments. But BRD, traditionally speaking, is a first 30, 60 days, at least front half of the feeding period is when it's concentrated. Not to say we can't have them later on, but if we want to create a storm, we place a lot of really high-risk calves in a short time to where they're all going through at the same time in that early, 30, 60 days on feed period. And, we've got to make sure that we're aligning that with the resources of the yard, not just facilities and infrastructure, but people. Yeah. And hopefully that, answers what you were, I guess, asking there. But
it's absolutely high risk and low risk cattle, understanding how many days on feed, how many animals we have concentrated in that first 30 to 60 days really helps us define our workload, and it gives us a good idea as veterinarians what's going on in that yard when we pull up. Yep. We're going to take a break. When we come back, we're going to get a little more granular with the data. Thanks for watching DocTalk. We'll be right back.
Meet Vault, EverAg's all-in-one risk management platform built to bring clarity and confidence to every decision. With Vault on your mobile device, you get a fast, easy view of the numbers that matter most. Real-time percent hedged, P&L performance, current market data, and more. Vault is here for cattle producers, ready when you are. Download the app for iOS or Android today and take more control of your operations risk management.
Success in the cattle business hinges on a lot of different people playing their part, from the vet to the cowboy and the nutritionist to the feed truck driver. You rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
I've been a veterinarian since 1987. My wife and I set up a practice in Monette, Missouri in 1989. We started using therapies shortly after it came out. I was overwhelmed with the positive response that we were getting from producers. They could noticeably see a difference. I have to admit that I was pretty skeptical at first. I am currently 110% sold on the product. There is no doubt in my mind that this is an added product that we can use on these cattle that is going to make a significant difference.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thomson. I'm here with Dr. Jacob Hagenmaier. We're here in our office. I can say that now. We have an office in Manhattan, Kansas, where Dr. Hagenmaier serves as the director and CEO of Prairie Rock Research. He's also a veterinarian that consults feed yards, cow-calf, stocker, packer, retail operations with me and Production Animal Consultation, just a great colleague and partner. We're talking about feedlot data. And we kind of got through defining the population, and now we'll get into a few more medical terms that maybe we saw when we talked about COVID, right?
Yeah.
And we were talking about people, but now we're talking about respiratory disease in cattle. And so we start out with the two basics, morbidity, mortality, right?
Yeah, so morbidity, basically a calf that was sick, or we based on visual appraisal, believed him to be sick, and so therefore we intervened with that calf. Doesn't always have to be an antibiotic. Most times it is. So that's what we look at first, first time morbidity or how many cattle were treated. And then mortality, just like it sounds like, how many cattle either succumbed to, disease pressure and died, or we also look at deads and removals or railers, cattle that didn't die but had a chronic condition that required to be removed from the broader feeding population.
So then when we look at morbidity and mortality, one of the things that's common to do is to do what we call an epi curve.
Right.
What is an epi curve, and what is its significance?
Yeah, so we can really turn data into information and knowledge by applying different statistical methodologies with various types of data. And so one of the ways that we can do that is what's called the epidemiological curve. And so we can look at cumulative incidents, to see when in the feeding period cases are occurring, how fast, what their slopes are. And by understanding when they occur in the feeding period, we can start to maybe dissect, okay, why, and what are some intervention strategies, again, that can help move the needle and mitigate that disease problem.
I think that's one of the things you do so well in yards is the ability to diagnose, look at the data, and then, instead of just looking at it retrospectively, being able to do it in real time with our database to be able to intervene, right, and make a difference in the outcome based on what we're seeing with the alerts.
Yeah, from an industry, we've had a lot of closeout databases, and they've provided a lot of value. But from a health perspective, anybody who owns cattle or has worked with them knows that the problem is there and now, and we're always worried about the ones that are under our care at that time. And so the more contemporaneous and real time that we can be with our measurements and our alerts to allow for timely diagnosis before, a match turns into a fire, the better we can serve our client to protect the well-being of the cattle under our care.
So one of the things that you discussed there, Dr. Jacob, was we talked about morbidity and mortality, and you mentioned it was railers. So when you think of a railer in a feed yard, what is something that you think of?
Yeah, and probably the most common cause of railers that we see is musculoskeletal issues, but respiratory, other causes of morbidity and mortality can also cause railers. But railers are those cattle to where, disease is not severe enough to where the animal dies, but our treatments, aren't resolving the case, and the calf just either needs a fresh start, a new location to go out, get healed up, and come back to the yard, or in some cases, we obviously want to be as resourceful as we can, and we realize that animal might not make it to the end, so instead we do a salvage harvest and get what we can out of that animal while also protecting its well-being. If it's a disease that could cause pain, obviously we don't want to just leave those animals to continue to endure that. We want to give them a humane endpoint or a fresh start outside the feed yard.
And a lot of times these are animals, they're past their they're not sick, they're just not growing,
right?
And they're past their withdrawal, and they're a good resource of beef.
Yep, exactly.
Just like cull dairy cows or cull cows or cull bulls or whatever. So when we come back, we're going to get into a little more granular. We're going to talk about case fatality rate and some other things. Is it the drug? Is it the calf? Is it the weather? Is it all the above? Stay tuned and find out here on DocTalk.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
Time is money on the farm, and your cows are less productive when they're stressed. The Alertus on-farm test from IDEX allows you to quickly test cowside and identify open or pregnant cows within minutes on your schedule in the parlor, barn, or chute. It's more efficient for your farm, very simple to use, and puts you in control. With minimal training and reliable, fast results, sample-based pregnancy testing is better for beef and dairy producers. Learn more at idexx.com/DocTalk.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight-shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it, though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
It's the drive, the passion, the unbridled desire to be the world's greatest. It's the early mornings, late nights, and every hour in.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here with Dr. Jacob Hagenmaier. We're in Manhattan, Kansas. Dr. Hagenmaier is the CEO of Prairie Rock Research. He's also a consulting veterinarian for Production Animal Consultation. Pleasure to work with, and one of the not rising stars, he's one of the stars of the beef industry and veterinary medicine. And we're talking about, okay, so we get called and there's a high mortality, high death loss episode. And at that point in time, people want to stop. And I always have to go to that quiet spot in my brain. Is this a morbidity issue, which we talked about earlier? Is this increased pull rates and morbidity and sickness that leads to increased death loss, or is it a case fatality rate issue? And what exactly is case fatality rate?
Yeah, so case fatality rate accounts for morbidity, but it's a measurement in its own. So case fatality rate, by definition, is of those animals with this condition that were treated, how many of them died? So to think of it another way, the mortality is the numerator, and then the number of exposed or treated cases as the denominator.
Yep.
And with high case fatality rates, that's when we're really concerned, because it's not a high morbidity issue, it's a high death loss with a low morbidity issue, and we can have that with BRD and other ones. And then we can have really low case fatality rates with BRD where we're treating a lot, but only very few are dying. And there can be different infectious agents or different nutritional imbalances or other disorders that could present with these various, case fatality rates or percentages. And so it starts to tell us as veterinarians, how do we start to dive in and understand corrective actions, again, to improve the outcomes of the population.
Yeah, and I think that's why it's very important. We're real good at tracking death loss, but not as good about tracking morbidity.
Right.
And having that ratio, 5 to 10% is generally speaking where we want to be on our case fatality rate, meaning 5 to 10% of the cattle we treat don't make it. That's generally speaking a normal case. But when we get into that 15 or 20% case fatality rate, we need to be examining other things.
Yeah. And I mean, obviously the one that comes to everybody's mind is BRD, and we can talk about case fatality rate non-BRD, but BRD is typically the one we discuss. And for us, the reason we target that 5 to 10%, to your point, is we want to make sure that our caregivers have the appropriate intensity. No antibiotics perfect in human medicine or veterinary medicine, right? But we want to make sure that we have the appropriate pull intensity, that we're being good stewards of antibiotics, but being a good steward of antibiotics means to give it to cattle that need it. And so we want to make sure that we're identifying the sick cattle and administering the antibiotics such that we, are targeting those case fatality rates and being on top of the population.
Yep. Right drug to the right animal at the right time.
Amen. Yeah.
And, I think we get into that too, where most of the time it's a morbidity issue.
Right.
Rarely is it the case fatality rate, because everybody's working hard to get things done. But it's a great tool to make sure that we're on track.
Right. Yeah. And there can be groups of cattle that, we talked about risk early on. There could be a low risk population that, for whatever reason, perfect storm, it can have high case fatality rates. And that's an example of we as veterinarians go to our caregivers and say, help us, understand what's happening in this pen, and let's be a little bit more aggressive and improve outcomes for the cattle.
It's perfect. It's why we define the population, the days on feed, morbidity, mortality, railer, case fit, all of it relates to come back to help you have better outcomes with the health of your cattle. Thanks for being here.
Yeah, I appreciate it. It's always fun to jump on.
It's great to have Dr. Hagenmaier. Remember, if you want to find out what we do, you can find us on the web at www.doctalktv.com. Always work with your local veterinarian. With Dr. Jacob Hagenmaier, I'm Dr. Dan Thomson, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.